morning, everyone, and welcome to another episode of Free Your Ass and Your Mind Will Follow. Today, we're going to be speaking about compassion and what our company does for people and what types of things brings us together and motivates us to really go out into the community and do the work that we do. So today, I'm here with Greg Taylor, the president and founder of Taylor for Life and the Vibrant Health and Wellness Foundation. And again, I'm Chase Rollins. How you doing today, Mr. Taylor?
Yeah, pretty good. How you doing? How you feel?
I'm good.
Yeah, one thing you just said, and the slogan, the Funkadelics came up with that slogan on one of their songs. Free your ass and your mind will follow. Meaning that you got to do something. And as Chase said, that I'm Greg Taylor, the founder and president of Taylor for Life, a health, fitness, and wellness consulting firm with emphasis on personal development. And one of the things that Chase, you and I are always talking about, compassionate. What are we compassionate about? Why do we do what we do? I mean, as I mentioned to you, that Taylor for Life was founded some years ago. My first client was a woman inspired to become an FBI agent because she was attacked by an intruder in D.C. and she managed to get away, but she said that she wanted to join the law enforcement so she can carry a gun. So in the event that an intruder tried to attack her again, she could defend herself. And back in those days, we were primarily focusing on fitness training, boot camps and stuff like that. I even had contracts. We were a private entity, but yet we had contracts with local army bases to train people in boot camps. So we were doing boot camps, or they call it the remedial program for soldiers that were kind of falling off the bandwagon somewhat. So we went in there, and 4 days a week we conduct these boot camps of push-ups, running and all this stuff. I mean, just like the typical boot camp with it was one of the most popular programs for 4 years, and then we started allowing civilians to participate as well. And so back in those days, we were heavily focused on physical activity. But as time went on, just like with human development, we got to always improve ourselves. And I saw a need to get more engulfed in this game of physiological perspective, but from a psychological perspective too, looking at nutrition, looking at life and health coaching to manifest the desires that people had in their life. And so we looked at all these things. We came up with a model where we talk about the individual. You look at yourself as you, and you got 4 factors that affect your performance. You got physical activity, you got nutrition, you got the environment, and you have high awareness. Now, when I talk about physical activity, the body wants to burn. The body reduces stress, keep you looking good when you do physical activity. The body wants to move. But you also gotta have the fuel for your body, so the appropriate nutrients in your body. But then you also have to be in the right environment to thrive. And that's why it's so important that we address some of the social determinants of health that impact a person's lifestyle and their growth. And then we have what we call high awareness. And when I talk about high awareness, this is motivation, God, what, not man, but what motivates a person from a higher conscious awareness. And you take all 4 of those factors into consideration. You just can't say, well, I'm going to lose weight, so I'm going to go out there and just stop eating, deprive myself of food. That's not going to work. I want to do this. I'm going to start, in the springtime or in January, people start exercising more, then they fall off the bandwagon. But we say, if you look at yourself from that perspective, and you take these 4 factors in consideration, the environment, high awareness, nutrition, and physical activity, and you look at all these things and you make the appropriate adjustment, and you got your five senses coming in, your taste bud, your sight, your feelings, your smell, and all these things are your inputs, and then your output is your gain.
Mm.
And so if you adapt and change or optimize these performance, chances are your output will improve.
Right.
That means you feel good about yourself, you're more healthy about yourself, you're less stressful, your environment is working for you. Right? And so all these things take in consideration. And so we started looking at that, going to, I attended Harvard University for lifestyle medicine, MIT for system health, Dr. V.A. Shiver. He was a great guy out there. Personal lifestyle medicine out in Seattle. Tyson Filia out in Laurel, Maryland. Now they're called the Maryland University of Integrated Health, offering PhDs in program in health wellness. And so I did all these to be in a position where I can more converse with physicians, healthcare providers, the science, understand the science behind human performance. And all this together enabled the organization to go out and understand what's going on in the community, how we can help our residents in the community. And let's say, for example, Capitol Heights. I talk about the social determinants of health and what impacts a person's health, such as 40% of your health is based on your lifestyle. If you smoke, drink, and stuff like that, bad sexual practices, stuff like that, that impacts your health. And so you got to take that. Only 20% having access to a doctor accounts for 20% of your health. But then you got another 40% that takes into consideration the safety of your communities and environment and stuff. And we find that a lot of people say they don't feel safe in their communities. And so these things we call the social determinants of health, we need to address. And what we're doing is saying, but then we said, for the last 4 or 5 years, we've been chasing this rabbit, social determinants of health, and advocating for these things in our community, providing food as medicine, partnering with farmers and stuff like that to provide fresh produce. But then we found out that I ran across a book called The Political Determinants of Health by Daniel Dawes. And what he described as something that, it's not all about our community and what we have or have not. It's these political drivers that are causing this effect, such as structured racism, the distribution of wealth and resources,
Right.
and the people in power. All affects the social determinants of health, which in fact it affects us, residents. And so when you look at that, and you want to know why people keep falling in the river, and you keep saving them, pretty soon you got to let me look upstream. What's going on? And that's where you find out that even, from the federal entity and the local entity, the state level and the county level, and these people in powers that be, as I say, structured racism, and also the distribution of these resources, wealth, are affecting our community. That's deeper. That's a deeper. You don't see or hear politicians talking about it.
Yeah, are they doing anything to really help our community out, especially here in Capitol Heights?
Well, let's say if you talk about Capitol Heights, Maryland, I mean, one of the things that we're working with Senator Benson, a champion for the community, District 24. I got to give her props of that. But the idea that she's been an advocate for the seniors there, for the 202 Coalition, addressing crime in the communities, resources, and we work with her to put together a $5 million grant, $1 million a year for 5 years to address healthcare access in the Capitol Heights area. Simply, you got roughly about 2,500 residents for one doctor, and that's diminishing. That's unheard of. We just had a practice that closed down because the practice couldn't find a doctor or a nurse practitioner to serve the patient. So she had to close down. You can't make any money. You can't thrive. You can't treat your patients if you don't have that physician there. And so we thought that, this is good news. We're going to get the money. We had a solid plan, and we're going to build. We had capability people in places to provide healthcare access, behavior change, coaching, everything. And then 6 months later, we find out that, unfortunately, our grant didn't fare out with the other ones.
Right.
And then when we asked, well, who got the grant? And then we found out all these large entities got the grants that I suspect they didn't need the money. But maybe they had board members on the commission. So, it's a lot of the political things at play that impacts our health. And one of the things, Chase, we need to do is start advocating for our community. Let's say Kamala Harris, she did a great job of raising $300 million in less than 2 weeks. Just thinking we could have what we could do with $10 million in our community. Healthcare access, fresh grocery stores, improve, reduce crime, giving resource to the kids, providing transportation is a big one.
Right.
We talk about maternal health and women of color having miscarriages and losing their babies, but we don't provide the structure. We can't afford to give out a grant or resources when we haven't addressed these things that's going to affect the likelihood of her having a healthy baby. And so these are the things we're compassionate about. We want to continue to advocate for. And I encourage you, if you're listening to this podcast, to contact us. Not so much just to give us our props, but to tell us how you can help us. We need help. We need to build an army to represent our community, to go in there and to rebuild our communities. Not looking for handouts, but helping. Everybody must be in the fight. So until we meet again, stay tuned.
Thank you.